The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of The Genuine Article, and today I'm talking to Dr. Kenneth Mukamal, and Dr. Mukamal is Associate Professor of Medicine at Harvard and at the Beth Israel Deaconess Hospital, and he's the first author of a very interesting paper, very relevant paper, I would say, appearing in JACC that relates to the risk effect of alcohol consumption. So there's been quite a bit of literature written on alcohol and heart disease already. Can you tell me what's unique about your study?
Sure. I think there's probably three main ways that our study differs from ones that have been done previously. The first is that we use the National Health Interview Survey, which is a nationally representative survey. So ours is really some of the first data appearing on this question that can truly be considered reflective of the entire U.S. population, and not just specific populations that may not be relevant for most people. Secondly, the study is pretty large, so we ended up with over 10,000 cardiovascular deaths and over 2 million person-years of follow-up. So I think we can say something pretty robust about the associations. And finally, the National Health Interview Survey includes useful information in trying to dissect out some of the questions that have dogged this literature about who doesn't drink alcohol and why they don't drink. And so we can compare moderate drinkers not only to former drinkers, but also to lifetime abstainers and individuals who've consumed alcohol only rarely throughout their lives.
Yeah, well, all those things were really attractive to us as editors in accepting your paper. I guess one of the limitations is you didn't have excellent data on hypertension, hypercholesterolemia, issues like that for risk.
That's exactly correct. One of the big limitations of the National Health Interview Survey is that although it's conducted in person, it doesn't involve any biological measurements. So although we had some self-reported information about health, we really don't have the kind of finely granular information you might want about cardiovascular risk factors. With that being said, we were able to see pretty much the same associations even amongst people who describe their own health as excellent. So I think that the results are robust, but not without limitation.
So what did you find?
Really, in just about every way that we were able to look at this, we found that the light and moderate drinkers, both in men and women, had lower risks of cardiovascular mortality, both for coronary mortality and to somewhat a lesser degree stroke mortality. There was no lower risk associated with heavier drinkers, people drinking above currently recommended guidelines. And that was, as I said, true in just about every subgroup that we looked at. The magnitude of the lower risk was in the range of about 30 to 40%.
So what constitutes a moderate drinker?
Well, at least for our purposes, moderate drinkers were women who were drinking up to 7 drinks, up to and including 7 drinks per week, and men who were drinking up to and including 14 drinks per week. So that those are up to the current NIAAA guidelines as to how much individuals should be drinking.
So a little bit of a J-curve, mild to moderate drinkers benefiting, heavy drinkers more than 2 drinks a day not benefiting and maybe even doing worse. So tell me, one of the questions that one's often asked at cocktail parties is, does it make a difference what kind of alcohol you're drinking?
It's a great question. It's not one that, unfortunately, we can answer in this study because the National Health Interview Survey doesn't ask about beverage type reliably. In our previous work, and I think in most of the previous literature, the answer seems to be no. If people are drinking small amounts regularly, it's really the ethanol that matters and not the other constituents of the alcoholic beverage.
So interestingly, the risk benefit for alcohol was primarily for heart attacks and heart disease, not so much for stroke. An interesting finding. Thanks a million for sharing your data with us.
The Genuine Article. Discussion and commentary based on articles from JACC.